As he built his pain practice over the years, Dr. Pyles became very interested in the modality of spinal cord stim. Dr. Pyles also instructed residents and fellows in advanced interventional techniques for the last 20 years through his affiliation with the University of South Florida. And over the years, he developed a reputation as an innovator in the treatment of chronic intractable pain. Please welcome Dr. Stephen Pyles.
So we're supposed to talk a bit about advancements in spinal cord stimulation for the treatment of chronic intractable low back pain. I am a paid consultant for Boston Scientific, and they take no responsibility for anything that I might say. So we also find that over time, using conventional spinal cord stimulator systems, we find that even if we do capture back pain or appendicular pain, that tends to diminish over time. Well, why is it so difficult to treat the low back? If you think about it, the dermatomal distribution in the low back is primarily attributed to the L1, L2 nerve roots. And the lower extremities are L3, 4, 5, and even the S1 nerve root for the foot and ankle. When the axons from those fibers ascend the spinal cord medially and rostrally in the neighborhood of the dorsal column, so we're able to stimulate those fibers, the number of fibers from L1, 2 are far outnumbered by the number of fibers from L3, 4, 5, and S1. There's almost a 4-to-1 ratio. With Boston Scientific, we can do something totally different. Because the Boston Scientific spinal cord stimulator system, we have a device that has an independent current to each individual contact. This technology allows us to fractionate the current between any two given cathodes. We can fractionate the current in 1% increments, much like having a rheostat. We can blend the current from one contact to another along the posterior neuraxis. And if you would envision the area in red as the area that we need to cover, if you will, to create a paresthesia to relieve the pain relief, you can see by fractionating the current along the contacts how we can get the appropriate coverage to relieve low back pain. Boston Scientific also has a new product. It's the first 16 contact lead. It will allow you to cover 3 vertebral levels. So if you're looking for low back pain, you can place their Infineon 16 contact lead and cover simultaneously T8, T9, and T10 to seek those low back fibers to get pain relief. If you're an implanter and you treat post-laminotomy syndrome, the low back has been known as the Holy Grail. Boston Scientific's device, with its multiple power sources and independent current control to individual contacts, allows us to shape the electrical field along the posterior neuraxis and increases our ability to create a paresthesia that will result in lasting pain relief. And their new device, their Infineon lead, will allow you to span 3 vertebral spaces and increase the probability of getting low back pain coverage.
I mean, the EpiMed needle hasn't been too far back. His needle is the best curved needle for that, and I use it every time I do a case.
He's a pioneer in the area of spinal cord stimulation. So to be quoted by Dr. Pyles is truly an honor. I use the Pyles needle for every case that I do.
When I first started doing spinal cord stimulation back in the mid-1980s, in fact, I was putting in leads for spinal cord stimulation a full 6 months before someone showed up and said they were going to help me with the technique, and I was a little bit puzzled as to how they were going to do that. By that time, I had thrown the needles away, the kit that were provided for me and the kit from the company, and had a needle company make a needle specifically for me to make it easier for me to put these leads in the appropriate place. And after I was introduced to other physicians who were attempting to use spinal cord stimulation technique, it wasn't long before they adapted my needle, and the use of the needle around the world became fairly common. Treating back pain with stimulation has been known to be extremely difficult in our specialty. And as I said, it's the holy grail of spinal cord stimulation to be able to effectively treat low back pain successfully. And finally, in 2012, we're able to do that successfully in the majority of our patients.